What does the percentage blockage in a Cath report really mean? So, your Cath report says 40% blockage, 60% blockage, or 70% blockage. What does this really mean? Do you need a stent? Let me explain clearly. Hi friends, I am Dr. Toishi Sharma, Interventional Cardiologist, and let's understand the basics of Cath report today. When we do a heart catheterization, we inject dye and look at your heart arteries on X-ray. The percentage blockage means how much plaque is narrowing the artery compared to what it should normally look like. It is a visual estimation in most cases. It does not mean that the blood flow is reduced by exactly the same percentage. For example, a 50% blockage does not necessarily mean that the blood flow is 50% less. How do cardiologists classify blockages? So usually a 0 to 30% blockage is considered mild. This is not dangerous and blood flow despite the blockage is normal. Usually a 40 to 60% blockage is considered moderate. Often the blood flow is still normal despite a moderate blockage. And more than 70% blockage is considered a severe blockage. This is when the blood flow really drops. And this is when symptoms occur and stents may be necessary. So friends, why do we say that in mild or moderate blockage, the blood flow can still be normal? First of all, the heart itself has a reserve. There is something called coronary autoregulation, meaning if there is a blockage in an artery, then the smaller arteries distal to that blockage automatically dilate so that normal flow of the blood is maintained to the heart muscle. Secondly, when the blockage is less than 70%, many times the blood is still enough for the heart to pump normally and to not cause any symptoms. Thirdly, when there is a blockage, many times if the blockage is severe and develops slowly, the body automatically makes something called bypasses or tiny collateral vessels that supply the muscle of the heart distal to the blockage. So friends, that's why when we see a mild blockage, we are usually sure that this is not causing symptoms. When we see a severe blockage like a 80%, we usually say this is significant. But when we see a moderate blockage, 40 to 70%, that information is not enough. We usually have to do extra testing to find out whether that blockage can be causing symptoms or not. And usually we do it with the help of something called DFR or FFR, which is basically a wire with a pressure sensor that we put on two sides of the blockage. And then we see if the blood flow is really reduced because of that moderate blockage. So friends, I hope it was helpful for you to understand how we classify the blockages as mild, moderate, and severe, the fact that we use visual estimate, and when we have a moderate blockage, we usually need to check it with additional testing. One more important point I would like to point out is that some people have a lot of calcium in their arteries. Their calcium score can be really high, but despite that, they don't have a significant blockage. That is because of something called positive remodeling, meaning the calcium or the plaque first gets deposited in the wall of the blood vessel before it actually narrows the lumen. And that can be another reason that you have a big plaque, a calcified plaque, but it is not causing significant symptoms. So I hope this video was helpful for you. If you have any questions for me, please comment in the section. And if you found this video helpful, please like and subscribe to our channel. Thank you.